Joining us live right now is Dr. Joe Congeni from Akron Children's Hospital. Good morning, Joe.
Congratulations, Ray.
Hey, thanks, my friend.
That's
Appreciate
really nice.
that.
Morning.
Now you're moving in stereo, my friend.
Awesome. But we need to answer a sports medicine question this morning.
All right.
And I have read a bunch of articles on this in the last 24 to 48 hours trying to make sense of it. I don't have a definitive answer, but I have a couple theories, okay? So everybody is talking at the NBA game the other night about Steph Curry, low energy. He's talking to the team doctor supposedly about energy pills, energy gel that he might take. He goes off and scores 25 points or something like that. And, of course, every kid wants to know what is it that Steph's taking, and I want to take some of what Steph's taking. And many of the articles actually called it energy pills, energy gel. Did you see some of that information about that?
I did, Joe. I did.
Okay. So here's the deal. There's really, I think, four plausible explanations, and I want to review those briefly with you, because a couple of them are new, I have to tell you. So, and then also then make some recommendations for kids, because what I deal with in the kids' world, and a lot of these things I don't think are reasonable for kids. But anyway, four plausible. Many people were talking in the literature about perhaps, as athletes a lot are just dehydrated. A lot of athletes, 3 to 5% dehydrated. They drink to hydrate. You see that all the time. But if they're really dehydrated, and you know that we talk about sometimes they go back to the locker room. He went back to the locker room. They get an IV in them. You know, with time of the essence in sports, sometimes the better part of valor to rehydrate people is just put an IV in and hydrate them. Dehydration is an option, but everybody was talking energy pills, so I'm not so sure that's what happened. Number two is caffeine pills. And here's you and I talking a lot about energy drinks and how much caffeine and moderate caffeine and a little bit of a risk for kids to be taking, and yet much of the theory out there was that he may have taken some sort of pill or gel with caffeine, maybe a moderate amount of caffeine, which reduces perceived exertion, which lasts a short period of time, but perhaps enough for the game, which the problem is, Ray, in a lot of people, if they take caffeine, they'll get jittery. It'll increase their heart rate. You may know the feeling as I'm having my my cup of coffee as I sit here to talk to you this morning on my desk, but a lot of us take caffeine. But caffeine, that jittery, increased heart rate for an athlete is not an ideal thing, but it may reduce perceived exertion. He may have taken some sort of caffeine pill. Number three is the gels that are out there that a lot of our endurance athletes use are glucose gels. And so the possibility that some sort of carbohydrate gel, of course good for our diabetics or people who get low blood sugar, may last for an hour and a half to 2 hours, but a gel, that perhaps a glucose-type gel that he may have been taking as the energy pill or gel they were talking about. And the fourth one that I hadn't heard a lot about and I read a lot about is a thing called L-theanine. And L-theanine is a new supplement that's out there, and it's actually a cognitive supplement. It promotes sedation and calm and the ability to concentrate more. And you might say to me, the sports medicine person, well, what's that? We're trying to get more, increase his energy, reduce his perceived exertion. But what people are doing is they're using L-theanine combined with higher levels of caffeine so that you can get the caffeine effect without the jittery effect, and actually perhaps with effects that would be good, like concentration, like cognitive ability with theanine, and they are calling this the smart caffeine, the combination of L-theanine and caffeine. Being studied, I checked a couple of research studies that are out there that are soft to start with. There will be more studies that are done, but one of those in those four areas I think are probably what was going on when they talked about Steph Curry with energy pills or energy gels.
Joe, from a medical standpoint, are there dangers to these?
Yeah, thank you. And especially in young people, Ray, a couple things to think about. Number one, what we always talk about is there will be a point where you'll hit the wall. And you may not know what that is, and it might be individually speaking. And in some of the studies I looked at, Ray, they say that could be an hour, hour and a half to 2 hours. Depending on how long the sporting event is, you may hit the wall. And individually, you may hit the wall sooner, and then really useless if you hit the wall, number one. Number two, you definitely don't want to experiment at the time of games. You probably, if you were using this, the higher level athletes, they use it during practice and other times so they know what the effect on their body would be. And number three, and I think this is what you're getting at, is we just don't know the effects. The cardiovascular system is very different in kids. I don't think this is at all for younger athletes. I know people are going to listen to this and say, hey, it worked for Steph Curry. I don't think we're looking at this for junior high athletes for sure. High school athletes, I don't necessarily agree with it. I might see it a little bit more when you get into the college athlete or the higher level athlete. There are some high school kids that are using this, but think about those three things: hitting the wall, don't experiment with games, and not so much for our younger athletes.
Well said, Joe. And I think as a parent's perspective, and I am of three kids that are in athletics, I would really question that for the young athletes, and it sounds like you are as well.
I am, and let's see where the information shakes out. There's some good research going on the next 2 or 3 years, and I'll keep you and your audience updated about what we learn.
Great stuff this morning, Joe. Thanks for being on board with us again. We'll catch up with you next week.
Thanks, Ray. Have a great week.
You too, my friend. Dr. Joe Congeni joins us Wednesday mornings here on the Ray Horner Morning Show, giving us an update on sports medicine. Well, listen.